Living Local presents BIZ BUZZ 413 with your host, Jill Monson.
And before we get started with today's episode of BIZ BUZZ 413, a couple quick thank you shout outs. Tiger Web Designs, thanks for making us look awesome on the World Wide Web. A thank you to my company, Pop More, confidence coaching and training done differently. And of course, a huge thank you to livinglocal413.org. I'm very excited to have with me Robin Sauve, Executive Director of formerly Baystate Ob Group, but now the cool hip new name that all the kids are calling it, BOGG, B-O-G-G. Robin, welcome.
Hi, thank you.
I appreciate you being here so much.
Happy to be here.
You've been just like such a champion of Living Local 413. The first thing I wanted to ask you was, in case people missed it, it's been a little bit now, but we had this awesome event, 413 Women's Health Connect. It's one of the initiatives as part of the platform. And you were not only the sponsor, but the doctor spoke. You guys really got involved. Tell us a little bit about why it's important to BOGG to bring women and care providers together to talk about women's health.
Great question. I'm glad you asked, Jill. As I think everybody knows at this point, there is a nationwide crisis for access to healthcare, and we are not immune here in Western Massachusetts. And so the point of our getting together is not to get patients, which is kind of an unusual thing for businesses in the area, but we are looking to attract providers. And the way that we want to do that is to by really spread the word as far as who we are, what we do. You cited our name change, our rebranding. Thank you for that. That was to differentiate ourselves from the hospital system. And I think we're doing a pretty good job of that. And so now it's up to us in our community to spread the word that we are here, we are growing, and we are doing whatever we can to get more providers into the area to get access to care for the women in the area.
Yeah. And first of all, I'm a Western Mass girl my whole life, born and bred here. And it is a great area. So hopefully this podcast is going to reach national acclaim. And someone in sweaty Arizona will be listening and say, oh, Western Mass, it's beautiful. And we've got 4 seasons and they should come here. And they just so happen to also be a OBGYN practitioner.
Right. Wouldn't that be something? Right.
So no, I've actually been going to BOGG since the old days. I think actually since one of my first adult womenly visits. And I've always found your practice to be very forward thinking, very open, and just very on the edge of what's going on in our community, which is why I think it's so great. And the changes are happening and we're watching them. And so I know that it was like sometime last year, I know Valley Women's Healthcare closed, and that was like a lot, like over over 5 digits worth of women were displaced in terms of their female care.
Correct.
And then recently, and this is where sometimes you hear the gossip, but gossip can also rumor can be fact. So I've heard that one of the bigger women's practices has dissolved or closed or is closing. And that's really sadly going to affect a lot of the women listening. So tell me a little bit about what's going on, like the truth as we know it, and then also what is BOGG doing to make sure that women are taken care of?
Yeah, that's another great question. Thank you. So as we know, last year around this time, Valley Women's closed. That was mostly due to retirement, but that displaced 17,000 women. So we were already trying to figure out how do we navigate that. And I'll tell you the master plan for that in a moment. But as you also cited, we did get some news, and it has been confirmed that Trinity Healthcare is also downsizing their women's health group as well. So it has been confirmed. Yeah, it's been confirmed that they closed their Agawam offices to OBGYN. They have told their patients they're not accepting new GYN patients at all in any of the Trinity locations. And they are also closing their offices for OBGYN at Mercy Hospital. So they're still doing labor and deliveries at Mercy Hospital, but now the only sites available for OB and I guess existing GYN patients are the Chicopee location and the Bicentennial Highway location. So again, displacing a lot of people there. So what is BOGG's plan? We started last year. We said, okay, well, we need to figure this out. And I'm going to practice this, but go ahead. Sorry.
No, I'm laughing because I'm thinking, yeah, you got to figure this out because that is a whole lot of women with reproductive organs and female problems and female planning that needs to happen. And without it, like, I'm just such a huge advocate for preventative care. And that's what you guys can give so many women. So without, this is like big time. So tell me.
Absolutely. Okay, yeah. And so we had a choice because we could continue to operate as we are and just see as many patients as we can. And if we got overwhelmed, we could just close the practice to new patients and then open it back up with this seamlessly and endless number of patients that are available to be seen right now. But we're not going to do that to the community. That wouldn't be right. So we are doing this full court press to expand and grow. So we have already hired 2 new OBGYN physicians. We have hired 2 new midwives. We hired a nurse practitioner, and to go along with that, the support staff, we're hiring medical assistants. We actually have some openings right now for that, as well as front office staff and triage nurses. And the big news is we are, instead of closing, we are opening an Agawam facility with a target date of October 1st. I know, super exciting. I know lots going on at the same time, but we're really doing whatever we can to help our community.
Can you tell us, can you give us like where in Agawam? Do we know yet?
Yes, we do. Yep, we have started the construction, so I can tell you now. So it is on 200 Silver Street. It's the former Anytime Fitness space, right on the corner there of Silver Street. So, yep, and we'll be right at the end of the building. So we will have some nice signage that everybody can see, and we're super excited. We will have 8 exam rooms, so we'll be good to go. Yes,
that's awesome. Because I laugh. I live in Springfield, but 413 is it's a wide amount of geography, and there's that river, and oh God, I got to cross the river. So this is really exciting for people that are listening to us that are in West Side or Agawam or Southwick, or even the Berkshires. If you want to come out from the Berkshires, Agawam's not that far. And trust me, as a patient, and this isn't a sales pitch. And like you said, you're not actively looking for more patients, but if you are looking for a practitioner in the OBGYN space, BOGG has never let me down. Tell me a little bit though about, the BOGG story and like what makes you so different and so unique. I mean, you unto yourself, Robin, you're in a role that a lot of practices don't see. You're not actually, in the exam room doing, my exam at least. But you're in this unique role and you're doing these great things in the community. So tell me about the BOGG difference.
Well, I certainly appreciate that. I mean, one of the things is that we are privately owned. And so that there's a lot that can happen with a privately owned company. And I'm happy to announce, I did a demographic study. We are actually now the largest privately owned women's healthcare practice in Massachusetts.
Wow. In the whole Commonwealth.
Yes, ma'am.
Wow. Snaps to that, Miss Robin. Very cool.
Thank you. Yeah. So what does that mean? So what does that mean to people listening to this? One of the things is because we are privately owned, we can make decisions very quickly. And so it doesn't take an act of Congress. So for example, when the Valley thing happened and we said we need to open a facility, we didn't have to wait to make that decision. Actually, our managing partner, Dr. Kevin Fitzgerald, had emailed me. He said, hey, I found this open space in Agawam. Do you want to go look at it? I said, sure. We went like the next day, and after our tour, we stood in the parking lot. We said, what are we going to do? We said, let's do it. Let's pull the trigger. And that's how.
Now, did they actually make you get the hard hat and the shovel though? No, I'm just kidding.
That would have been fun, but no, because it was just a complete blank slate. It was just an empty former gym. So it was great to be able to apply our own vision to it.
Yeah. No, but you're right. Like so many times you hear like, it's a great idea. And then I feel like, I like say a mom, right? I don't have any kids of my own, but like a mom goes through her whole pregnancy, has the baby, the kid's in college, and then the idea happens.
Right.
You don't have to do that. You get to make decisions. Yeah. That's awesome.
And to your point about my role here. So I was the result of a year-long nationwide search for an executive director, and it just so happened to be I'm like living in the shadow of our Longmeadow facility. Complete coincidence. But with that, the partners were wise enough to recognize that they needed a very strong business leader who also had a medical background. And I have many, many years of senior leadership in the healthcare space. So it was a great fit. And they are really open to listening to suggestions, being innovative, because that's what it's going to take right now to get through this crisis and navigate this crisis, and working together towards those solutions. And it's just been a really great partnership.
Well, and I think it's fantastic because as a consumer, meaning literally as a patient of the practice, but as a consumer in this region, we so often segregate things like medical and business, and we don't think about them in the same. You can have great medical care while still having a good business mindset. And by having you on board, I think they're able to satisfy both sides of that. So that's amazing. So we unfortunately are going to have to wrap up because I would talk to you pretty much from now until next week.
Thank you.
My last question is, like I said, hopefully we're going to go nationwide and somebody's going to hear this, but I'm thinking somebody here in in Chicopee is listening, right? And they're like, oh my goodness, my sister is about to graduate in this medical area. And I've really been wanting her to come out to Western Mass. And now I can tell her. What are some of the key things that you think, like the bullet points that you would give somebody about why, not only why BOGG for their career, but why Western Mass?
Right. Great question. Thank you. So the big thing, and this has been my mantra since I was in healthcare, the BOGG way of thinking is everything that we do has to check 3 boxes. 1, is it good for the patient? 2, is it good for the employees? And 3, is it good for the practice? And it has to check all of those boxes, or we need to retool the way that we're thinking. And that is so unusual in healthcare. Yeah. So that's our culture. That's what we do. So as far as the benefits of Western Mass, I just had a conversation in my office the other day with the chief resident from Baystate, who we hired, who is coming on board at the end of the summer. And she had been interviewing, as well she should, in Boston and other big cities. And she said, you know what, Robin, I'm so glad I chose this area. It's pretty much the same money that I was offered, but the cost of living is so much better here, and we're accessible to all these other cities anyway. So why wouldn't I move here? Right. And I was like, well, I need to get that on tape because that's exactly what it's all about. Yeah, and that's just, as you know, Jill, scratching the surface of all the wonderful reasons to live and work in Western Massachusetts,
which we are going to continue, thank you, Robin, to explore right here on BIZ BUZZ 413, because that's the point, right? Western Mass is a wealth. We just don't brag about it enough. So we're going to start bragging politely and humbly, but bragging a little. So thank you so much, Robin Sauve, Executive Director of BOGG, also known as Baystate Ob Gyn Group. I appreciate if you are listening. Thanks for tuning in, because we can only make Western Mass great if we talk about it. And it is BIZ BUZZ 413, where you're going to hear all the things going on. We are shining a light on Western Massachusetts, on the business community, and those people in the community whose passion, grit, and creativity are keeping the region thriving. So again, thank you so much. We are going to continue. There'll be more to come. We're going to have them available on our website. You can get it at Apple Podcasts, Spotify, wherever you get your podcasts. And don't forget, if you have an idea for me, somebody you think that I should be talking to, or a topic that you want covered, make sure you reach out. You could do it on our website at livinglocal413.org/bizbuzz, or email me directly at bizbuzz@livinglocal413.org. On behalf of myself, Jill Monson, and Bill Cole, we appreciate you. And remember, 413 just rocks.
BIZ BUZZ 413 was brought to you by Living Local.